Meanwhile, South Africa's top scientific advisor to government says he feels he let the country down. Professor Salim Abdool Karim, the chairperson of the Ministerial Advisory Committee, was speaking to SAfm. He says he could have done more to ensure that South Africa entered the vaccine race, and that we should, as a country, have joined last July. Let's speak now to the chair of the Ministerial Advisory Committee on COVID-19 vaccines. That's Professor Barry Shoub. Professor, thank you for being with us. Firstly, do you mind commenting? What do you think when you hear Professor Karim saying he felt like he let South Africa down? All right, Professor, if you can hear me, we're very sorry, but we lost your audio. So a technical problem there. In fact, I believe you are back. So again, what do you think of Professor Karim saying he let South Africa down?
Yeah, I think he mentioned it in a completely different context. I think what he was talking about was that they had a research idea, I think, in about the middle of last year, which I didn't take forward. They didn't actually develop it. So it really wasn't focused on developing a vaccine. I mean, it was more a research project, being a partner, a research project to develop a vaccine rather than it was to let the country down in terms of procuring vaccine.
Yeah, sure. He's saying right now we should be in the vaccine race. That comes in the form of procuring vaccines or even manufacturing vaccines. He said he had a discussion with a colleague around manufacturing a chicken vaccine. I don't know if you can explain that, but I guess hindsight is 2020. So in the middle of last year, I mean, was it possible to think of what sort of facilities you would need for the vaccine that would ultimately be successful? Pfizer needs cold chains. Could that have been predicted, for example?
Yeah, I think these are all things which one is very, as you say, wise in hindsight. The chicken vaccine option, you must remember there are about actually 280 at the moment candidate vaccines which are being evaluated from the laboratory stage onwards, and about 60 on clinical trials. So let's put it in that kind of context. So this is one of the ideas which wasn't taken up. I believe there are some laboratories overseas which are also looking at chicken vaccine. The chicken vaccine is actually a similar coronavirus, which is well developed in the veterinary field. And the idea was to take that and export it into the human vaccine field, because a lot of the preliminary information is already available there. But as you say, one can look back and say, well, why wasn't this done? Why wasn't that done? Did we drop the ball there? Was there a mistake done there? I think one can really kind of, look for items to blame. But I think the important thing really is to kind of grab the ball now and go forward.
Is he not right, however, overall, that we've dropped the ball here? I mean, South Africa is now talking to manufacturers about securing vaccines when we know people are getting the jab in various countries around the world. Are we not just way behind already?
No, not at all. Look, we're starting in January, and most countries around the world are starting in January. Even the countries which have the most advanced, like United Kingdom, they'll only be going for about a month. So we're not really far behind. We are really amongst the front runners. In fact, we're starting now probably at the end of this month or beginning of next month. Some countries, like, for example, Australia, New Zealand, South Korea, they prefer to actually wait it out and see how it rolls out in other countries before they start theirs. And they're starting their campaign only, I think, in March. So we're not totally left behind. And I think you must remember we are a middle-income country. It's really the high-income countries which have got the high-income vaccines. So, some of the middle-income countries have started, that is true, but they have opted for vaccines which haven't quite met the regulatory standards of our regulatory body. They're taking the Russian vaccines, the Chinese vaccines, and so on.
But Professor, look at India, producing vaccines, ensuring that its whole population is vaccinated. That's the plan, and then selling on to other countries. Doesn't that put us to shame?
Well, the Serum Institute of India is the world's largest manufacturer of vaccine, the world's largest. So they've contracted to the vaccine AstraZeneca, developed in the UK, to produce vaccine. They've got a facility for massive output of vaccine. And that's where they are at the moment, and that's where we are getting our AstraZeneca vaccine from. So remember, they are, some countries do have enormous vaccine manufacturing capabilities. India has the biggest in the world.
Yeah. I think there was talk also in the discussion yesterday with SAfm about manufacturing. Again, if we had gone back to July last year, spoken about setting up facilities. I mean, there was a money crunch, and the focus was on hospitals. So it would have been a hard ask to even start setting that up then.
Yeah, looking back retrospectively, one can make that argument. At the time, and remember, our advisory committee only started in the beginning of September, so it hasn't been in existence for that long. But at the time, the vaccines were undergoing trials. We didn't know at that stage how effective they're going to be and so on. So you had to put on a non-refundable deposit, which actually came to about 2.4 billion, with a B, billion rand. And remember, our economy is really kind of not in the best shape. We're not up there with the high-income countries who could have afforded to do that, to put a non-refundable deposit at risk that they might not get it back again.
But apparently some manufacturers were asking for no deposit.
Not that I'm aware of, and I've got my information from the Department of Health. And the Department of Health, who do the procuring, they've assured me that you require a deposit before you can actually make any advance commitment, any advance purchase commitment.
All right, thanks for clearing that up, because there are academics who've said that's a bogus argument, because a lot of the manufacturers weren't asking for deposits. Maybe the health department closer to those actual negotiations. Can you manage our expectations now?
Yeah, can I just answer?
Sure, sure.
That's exactly why COVAX was set up. It was set up because middle-income countries couldn't afford it. It was only the high-income countries. So it's, first of all, the information is from the Department of Health that do the procurement. Second of all, that's precisely the reason why the COVAX was set up, to get equitable distribution of vaccines for the middle-income countries who couldn't afford to do that advance commitment of putting down a vaccine, putting down a deposit for the vaccine. So I'm sorry, the academics are wrong.
Can you manage our expectations now? I felt this sinking feeling the other night when the president spoke about the logistics being as big or even bigger than the rollout of ARVs in this country, which we know took years. Is it that big? And we know that in America things went much slower than expected, still going very slowly. What does that mean for a country like South Africa, trying to get the vaccines in the right hands and into people's bodies?
You're absolutely right. This is an enormous challenge, and as the president said, it's a unique challenge. We haven't had this challenge even with the ARV rollout, the antiretroviral rollout, and even a country like America, as you said, initially they planned, I think, for the end of last month, or maybe it's a week or two ago, to have reached 10 million doses, and only got to 4 million. So, individuals, I should say, not those individuals. So, yes, will we succeed? Well, time will tell. It is certainly a very, very big task. But you must remember, this is unprecedented, because we've never had a universal vaccination campaign for both adults and young individuals as well.
Yeah.
We've always had a universal campaign for infants and young children, not for the entire population. So this is going to be a major challenge.
So when government talks about reaching herd immunity, in effect, is that actually years off, or do you think that a plan can be hatched here, that miracles can happen?
Well, the president did say that we would be achieving it by the end of the year, and the Minister of Health.
Is that vaguely possible?
Yes, it is possible, but it's a major challenge.
And you're saying we haven't bungled this up thus far, but are the right people, the right brains, is everybody who can help hands on deck right now?
We're going to have to recruit the right brains, the right hands on deck. We're going to have, they're projecting you need about 6,500 healthcare workers to administer vaccines at a rate of about 50 per day. It's a very tall order.
Yeah.
Let's face it, tall order. But the country has done it before with ARVs to become the world's leader in antiretroviral therapy. So let's hope they can kind of emulate that achievement and do it with COVID vaccination.
All right, a hard road ahead. Professor, before we let you go, you have been talking about the situation in South Africa, the second variant. Has it surprised you, just the rate of spread right now, and where we are after hopes that we would recover after the first wave?
Well, yeah, we should. From a virological point of view, these are viruses which do mutate regularly. They multiply on a regular, fairly rapid basis, and therefore they pick up mutations. And these mutations usually are harmless. Unfortunately, it has surprised us to a large extent in developing a mutation which potentially can be resistant to the vaccine. This still is work under progress. We're not quite sure if the vaccine is going to be resistant to the vaccine or not as yet. We just have to wait and see. There's a lot of research going on around the country to establish whether, in fact, the vaccine will be effective or not.
And if it's not, I mean, South Africa really out in the cold, then, and people are saying, why us? I mean, is there any sort of answer to a question like that? Why does this variant produce itself or manifest itself in South Africa?
Well, I think that, the one thing is that South Africa has got a very, very good monitoring and genetic surveillance system. So it may well be out in many, many countries which don't have as good a surveillance monitoring system. Why South Africa? It's just bad luck in a way, because these mutations are sporadic. They just happen. But I suspect part of it is that we are monitoring for it and we picked it up. I would imagine that, in fact, it is present in many, many other countries where they haven't got such extensive monitoring that we have. I think it's a tribute to our scientists who've done that monitoring exercise.
And all right, we have to leave it there, but thank you very much. A very interesting discussion about where we are in the vaccine race. Professor Barry Shoub, Ministerial Advisory Committee Chair on COVID-19 vaccines, saying we haven't messed this all up.